Hello and welcome to Health on the Go, a podcast where we discuss everything health economic and a bit more. I'm here today with your host, Ogun Kano. How are you doing?
Hello, Matilde. I'm doing good. Enjoying vacations, summer, family. Yup.
Same. As some very warm day here in Belgium. We hit the 35 degrees almost. So, yeah, loads of not doing much, which is pretty funny on.
Well, here in northern Mexico, I think that's a good weather for us. So I'm a little bit jealous of you.
Yeah, finally you can be jealous of Belgium weather. It's not very often, so
I
I'll
know, I
enjoy
know,
it.
but it's quite rare, right?
Yeah, well, every year we have it a bit on summer, but it's usually only a few days. So yeah, we take full advantage of it.
Very, very good. Okay, so what's up for today?
Well, today it's a special summer edition. So welcome to our summer special. And for a summer special, we are shaking things up a bit this time. Instead of our usual deep dive into a non peer review paper, we're sharing a refreshing way to stay informed about global health while you relax on the beach with a cocktail or a mocha in hand. So, one of our top recommendations from my side is the Global Health Now newsletter from the Johns Hopkins Bloomberg School of Public Health. This weekly digest captures the pulse of global health world, delivering key events and insight to your inbox. Global Health Now offer a curated mix of content, including summaries of important tweets from the WHO Director General, Dr. Tedros, or highlight from recently published research paper, as well as concise overview of breaking global health news. And what's the best part? If a topic piques your interest, you can easily deep dive with provided links to full article and resources. So, whether you're lounging by the pool or catching some rays, stay connected to the world of global health with this informative and easily digestible newsletter. It's a perfect blend of relaxation and education for any global health conscious vacationer.
Very good. Thank you, Matilde. So my recommendation is a little bit more different, I will say. So there are a lot of things that I'm subscribed, and I usually get news from a lot of magazines, papers, scientific magazines. But there's one that I think stands out because it's very interesting, it's very informative, it's a mix of a lot of things that you normally don't read if you are in the health sciences. So it's Nature. The Nature Briefing newsletter, I find it quite interesting. It has news about ranging from robotics, AI, microbiology, cancer, policy research, even some fun news in the weekends. So if you are looking for something a little bit outside of the box, a little bit that is not quite common to read, then I highly recommend reading the Nature Briefing newsletter.
Oh, thank you for this recommendation. I will definitely subscribe to it. I've been subscribing to a few different medical journal, but I never thought about the nature one. So one more for me. Thank you, Agun.
Yeah, I hope you like it, and also you can curate it if you want to read more related to microbiology. If you are more into robotics, into AI, maybe you want to read something about space. Then I think the Nature magazines are over 30 or 50. I'm not quite sure. So yeah, you have a blend of a little bit of everything if you are into that. Okay, so let's kick in. For today's episode, I chose a document. So, for our listeners, today I'm going to be very much focused on women's health. That's something that was not quite, I was not planning for that, but it came up. So, I'm pleased that both of my papers are kind of related. They are more into the, again, women's health topic. So, the first document is titled Cost of Illness of Breast Cancer in low and middle income countries, a systematic review. So this is authored by a group of scientists from the Malaysian Ministry of Health and the University of Science Malaysia. The principal investigator is Siu Wei Hyong. I think that's how it's pronounced. Sorry if I'm mistaken. So we know breast cancer remains a leading cause of cancer-related deaths among women globally, and its economic burden is particularly pronounced in low and middle-income countries. This document is crucial for our audience as it sheds light on the financial implications of breast cancer in these regions, where healthcare resources are often limited and the disease is diagnosed at later stages compared to high income countries, where we can say that the disease is diagnosed in the early stages, therefore, it's less expensive for the healthcare setting. So, the authors conducted a systematic review of cost of illness studies focuses on breast cancer in low middle income countries. They meticulously analyzed 12 studies, converting costs to 2022 US dollars values for consistency, and they found a variation in costs across different settings. Direct medical costs per patient range from 195 US dollars to more than 11,000, nearly $12,000, while productivity losses can be as high as $26,000. These disparities highlight the significant financial burden on patients and healthcare systems in these countries. One key takeaway that I found particularly useful from this review is the identification of hospitalization as the highest cost driver in direct medical expenses. Additionally, the lack of sensitivity analysis in most studies point to a gap in predicting breast cancer outcomes and underscores the need for more comprehensive analysis in future research. So, I think it's essential to reflect on the broader implication of these findings. The economic strain of breast cancer in low middle income countries not only affect individuals patient but also poses challenges for national healthcare systems. This review calls for more robust cost of illness analysis studies that incorporate sensitivity analysis and consider the correlation between cost components and other variables. Such efforts, I think, could inform better healthcare resource allocation and planning, ultimately improving cancer care in these vulnerable regions. So, also for our audience, right now I'm the head of the cancer prevention program in my state in Mexico, and I found this information quite interesting and also useful because for many weeks from now I've been thinking about, okay, if we want to really impact cancer prevention, we are doing it to prevent what? Of course, we want to reduce morbidity, we want to reduce mortality, but ultimately, where are we actually addressing this challenge of the cost? And it makes sense that it's in the hospitalization because, well, Mexico is a free provider for most patients. They're not going to pay for their own health. Rather, they're going to go to either the Social Security, to the Ministry of Health. So just having this information for me is very useful because I want now to take a look how much it will cost outside of the outside of the public setting, in the private setting, the hospitalization, and maybe conduct a more, let's say, internal cost of illness analysis and see if the results are comparing, obviously not in the US dollars, not in the same cost, but if we found that also hospitalization is the leading cause of spending in our sector. So for me, this was interesting because it kind of guide me through where I should be looking in terms of reducing costs and also reducing morbidity.
Okay, thank you. That's a very interesting, study. And as you say, it really links very well with your current work that you're doing. So even more important for you. But yeah, I found it was an important paper in which I got quite surprised, to be honest, that there were so little, so little different papers that I got to review. Like, I really thought that breast cancer would be way more studied across those. And sometimes they did refer to some issue with the methodology of all the papers, and that sometimes not even any economic wording was using in the title, so that it was so hard to find those studies. So that's something I was quite surprised while reading this paper, and thinking of that and the fact that why are there not as many studies? Could you say and explain why are those cost of illness studies important for breast cancer research? especially in low and middle income countries?
Yes, thank you. So that's a good question. So cause of illness studies play a role in breast cancer research for low and middle income countries for several reasons. First, they provide valuable data on the financial burden of breast cancer on both patients and the healthcare system. Then, this information is essential for decision makers in both public and private sectors when allocating resources and designing healthcare policies. Moreover, these studies will lay the groundwork for more comprehensive cost effectiveness analysis, such analyses are vital for developing appropriate breast cancer treatment protocols and early detection strategies that are more tailored to the specific needs and research for low middle income countries. By increasing research funding of cost of illness studies in these countries, we can gain a deeper understanding on the economic impacts of breast cancer. This knowledge, in turn, can inform more effective and efficient approaches to breast cancer care, potentially improving outcomes for patients in limited resource settings. Again, I think this very much comprehends what I was trying to say in the beginning, that right now I can take a look, see if this data correlates with our own data, and then in the future we can do potentially, of course, if time permits, a cost effectiveness analysis to see if more mammograms, if more self exploration. Obviously, the education of the patient is important, but I think first these cost of illness studies again will provide a good groundwork for more detail oriented or more technical work in the cost effectiveness kind of studies.
Yeah, thank you. And if you end up doing a study, as you mentioned, please share it and we'll go back to this paper and see how it correlates now. Would be very interesting.
Yes, of course. That
I
will be
look
the
for.
idea. Self promote my work
Well,
in the
yes.
podcast.
Let's take advantage of it. Okay. Well, that was a very thought-provoking work. Really, thank you for sharing it. And well, I'll jump into my section. But before that, I think we went ahead very quickly because we're really excited to be here, as it's our first summer special edition. As we mentioned earlier, we're shaking up a bit things. So in this episode, we don't have only 3 papers that we're reviewing, but we'll be reviewing 4 papers, 2 from July and 2 from June. So we're doing mid of 2 in 1 episode. To be honest, we took a month to enjoy the holidays. Personally, I went away, so I didn't have my computers for a few weeks. So that's why we're doing this summer special edition. So I'm gonna start my paper. Is the June papers in this case, and I'm reviewing 2 papers. So the title is Crowding Out Effect of Tobacco Consumption. So today we're diving into this fascinating topic, the crowding out effect of tobacco consumption, as explored in 2 recent studies published in the BMG in June 2024. But first, let's break down what we mean by the crowding out effect. It's not just economic jargon, it's a real world problem. So imagine a household as a budget pie, and when a slice goes to tobacco, it leaves less for everything else. That's the crowding out effect in action. So these 2 studies that I selected, one conducted in Serbia and the other in Mexico, are both funded by the Bloomberg Philanthropies and the University of Illinois at Chicago. They caught my attention for a reason. I am someone who's have long been intrigued by the smoking behavior, especially the paradox of continued smoking despite all the non-health risk. And I found the finding of these 2 studies particularly compelling. So those 2 studies use sophisticated econometric method based on the angle curve and the household utility function to understand what happens when houses someone spend money on tobacco, what happens with the rest of the money they have. So the key findings from these 2 studies are first that tobacco spending substantially reduced expenditure on essential like food, education, and healthcare. And interestingly, it increased spending on complementary items such as alcohol or dining out, and so on. And furthermore, these effects are even more pronounced in low-income households. In addition, the Mexican paper shows smoking as an impoverishing effect on the population. This is because some families find that their remaining income level falls below the poverty line after deducting money spent on tobacco, a concept known as secondary poverty. In Mexico, around 900,000 people are left with disposable income level below the extreme poverty line because of the money they spend on tobacco and smoking related disease. That's nearly 1 million lives dramatically altered by smoking. Now, also a quick note on the methodology. Both studies had to grapple with the challenge of endogeneity, so they couldn't use the standard estimation method, the ordinary least square estimation method. So the Serbian study employed instrumental variable, while the Mexican study used a general method of moment, three-stage estimation. I found it quite interesting that both they had the same problem but went through different avenues to solve it. And finally, in summary, both studies demonstrate how tobacco consumption distort household consumption structure and negatively affect family development. They provide compelling evidence for policymakers, highlighting the broader socioeconomic benefit of effective tobacco control measures beyond public health improvement. This research underscores the far-reaching consequence of tobacco use, extending beyond individual health to impact family economics and social well-being. As a result, both studies advocate for stronger tobacco control policy, including tobacco tax, to mitigate the economic impact on households.
Thank you, Matilde. I think you did an amazing work at the beginning when explaining the crowding out effects. As you said, both studies highlight that tobacco consumption disproportionately are going to affect low-income households, exacerbating their financial strain, and also limiting the people living in the household for essential items such as food, education, healthcare. I think in the Serbian argument, they will also trying to say that people dining out are going to be less in these kind of families. So those are kind of the similarities. But in terms of the differences, what would you say is the role that tobacco control policies play in mitigating the economic impact of tobacco consumption on households? What are the differences between Mexico and Serbia?
So yeah, tobacco control policies and they play a crucial role in mitigating the economic impact of tobacco consumption on households, primarily by reducing tobacco use and freeing up household resources for essential goods and services. In Mexico, the focus is on increasing tobacco taxes. This approach serves a dual purpose. It aims to reduce smoking rates while also addressing poverty. Higher tax could potentially decrease tobacco consumption, allowing households to redirect funds toward critical areas like health and education. This strategy is particularly important in Mexico, where the study has shown that tobacco-related expense push a significant number of people below the extreme poverty line. In Serbia, on the other hand, the study emphasized policies that enforce smoking bans in public places and provide support for smoking cessation. These measures are designed to reduce tobacco expenditure and its negative economic impact on a household by creating smoke-free environments and offering grid support. Serbia aims to decrease overall tobacco consumption and its associated costs to family. However, the effectiveness of this policy might differ between Mexico and Serbia due to several factors. The enforcement level, such as the strictness with which these policies are implemented, can vary. The cultural attitude towards smoking, the availability of cessation support, and the economic context. Both countries have very different economic situation. In conclusion, while both Mexico and Serbia are using tobacco control policy to mitigate the economic impact on households, the approach and the potential effectiveness of this policy are tailored to the specific national context. This underscores the importance of considering cultural, economic, and social factors when designing and implementing tobacco control measures.
Yeah, it's very interesting. And I think one takeaway from me is that in Mexico, we're not doing too much in terms of delivering these support services after people quit smoking or during the process. I think the strategy is more increase the costs until one day people will say, okay, I'm no longer going to buy it. But what happens to people that are highly like they are clenched, right? They are addicts to smoking. I have not seen a lot of clinics actually. I have not seen a lot of programs. So it's interesting that the approach is quite different in places like Serbia, and also in the context that Mexico has always been like a champion worldwide in terms of tobacco control. But I think there's room for improvement according to
Yeah,
this evidence.
definitely. I think when Mexico is not yet perfect now in tobacco control, after living in Mexico and then living in Belgium and going, I can see that way more people are smoking over here. Oh, at least it's my own impression.
And for our audience, it's not that we intentionally try to look for Mexican papers. It's just that they came up. So again, this I think is the second or third episode that we end up talking about a Mexican paper. But hey, we're trying to diversify information, and lots of time we're reading about the European and the American studies. So it's good to introduce some of Latin America. I promise that for next episode, I will try to look for a different paper either from Africa,
Yeah, it's true that
Asia, or
we are slightly
Latin
biased
America,
now, and
not
everything
Mexico.
we see about Mexico, we like, oh,
Sorry
it's
for that.
even more interesting. Yeah.
Yeah,
Yeah, we'll
so
try to
it's
make
not
it
on
on
purpose.
purpose
It's not
the
on
other way.
purpose.
Okay.
Okay. Yeah. Okay, so my second paper, as I was saying in the beginning, is also related to women's health, and it's titled A Cost Effectiveness Analysis of Early Detection and Bundled to Treatment of Postpartum Hemorrhage alongside the Emotip trial. This is authored by some folks from the University of Birmingham and the World Health Organization. I think this also is a good wrap because I found this in a Nature journal, and there are not a lot of cost effectiveness studies published there. So I just decided to take a look, and it was interesting. So let's try to discuss it. Postpartum hemorrhage is a leading cause of maternal mortality globally, particularly in low and middle income countries. The economic burden associated with PPH is substantial, affecting healthcare services and families alike. The Emotip trial, which this document evaluates, was conducted across multiple countries, included Kenya, Nigeria, South Africa, and Tanzania, involving over 210 women. The trial assessed the cost effectiveness of a novel intervention using a calibrated blood collection drape and a WHO recommended treatment bundle. The study employed a cluster randomized design to compare the Emotip intervention with usual care. The primary outcome measure were the cost per severe PPH case prevented and the cost per disability adjusted life year averted. The results are compelling. The Emotip intervention significantly reduced the incidence of severe PPH from 4.3% in the usual care group to 1.6% in the intervention group. This incremental cost effectiveness ratio was calculated at 11.83 cents per case, that is $11.83 per case of severe PPH averted, and $113 with 91 cents per daily averted, making the intervention not only effective but also economically viable. So I think these findings invites us to reflect that it's essential to consider the broader implications. These studies highlighting the potential for cost-effectiveness intervention to save lives and reduce the healthcare burden in research-limited settings. However, it also raises critical questions about the implementation and scalability of such interventions. Number one, how can healthcare systems in low resource settings overcome barriers to adopting these life saving measures? What role can international organizations and policymakers play in facilitating access to innovative healthcare solutions? Again, because of the setting, this is hard to kind of translate to other places, but will be interesting in places like Latin America. I think these findings challenge us to think deeply about the allocation of healthcare resources and the importance of investing in interventions that offer both clinical and economic benefits.
Okay, thank you for sharing such an important work. I think not always talked enough about. So I guess thank you about that to share both paper related to it. And in this case, like I saw that the researchers use the pooled approach for the cost effectiveness analysis. What are the implications of this method?
Yeah, good question. I like the again we don't usually talk about cost effectiveness studies. I think a lot of people knows it, and I also like the challenges of methodology and technical questions. So thank you for that. So I guess that the research use a pool approach for their cost effectiveness analysis to address the complexities inherent in a multinational cluster randomized trial. This approach allowed them to combine clinical data from all patients participating in each country while applying a country specific unique cost and life expectancy data to all patients in the trial. This method was chosen, I guess, again, I have not seen any interview, to provide indicative information on cost effectiveness that could be useful for decision makers across different contexts, despite not being fully country specific. The implications of using a pool approach are significant. Number one, it allows for the estimation of cost effectiveness across a wide range of settings, which is particularly useful in trials involving multiple countries with varying healthcare systems and economic conditions. However, this approach also requires careful interpretation, as it may not capture all the nuances of each individual country's healthcare environment. The pool analysis therefore provides a generalized view that can inform policy decisions but may overlook specific local factors that could affect the implementation and cost effectiveness of the intervention in individual countries. Thank you for your question, Matilde.
Great. Yeah. That's very interesting because yeah, usually we don't see the pooled approach, but it's true that they have the analysis is done internationally between I think it was 7 countries or a bit more. So yeah, the fact that they can use this method to not lose the value, no?
Yeah, so as you mentioned, number one, published in Nature. So we are expecting
Mhm.
a method heavy paper. Number two, cost effectiveness. So that makes some noise. And number three, yes, exactly. We don't usually see a lot of cost effectiveness there across different countries. And this one in particularly being in different economies in the African continent also makes it quite interesting to evaluate and see how the others make their methodology approach. And for me, to be honest, this is the first time that I see a pull
Yeah,
approach being used in
for
a
me
in
too.
a in
So
a cost
thank you
effectiveness
for sharing and
analysis.
I got to learn something today. So yeah, thank you. And well, I'll go to my second and last paper for this episode, which is called Sales Revenue for New Therapeutic Agent approved by the United States Food and Drug Administration from 1995 to 2014. So today we're diving into a fascinating study that hits close to home for me. It was published in July in the Value in Health journal, and this research was conducted by a team from the same LSE department where I completed my master degree. So, this study offered a compelling look at the financial journey of new drugs in the global market. Let's break it down. The researcher analyzed global sales data for 361 new therapeutic agents approved by the United States Food and Drug Administration between 1995 and 2014. Their goal to determine how long it takes for this drug to recoup the development costs. The key finding of the paper include the median sale revenue per product was staggering 6.7 billions, with total sale reaching an astronomical 5.5 trillion. Sales were dollars, sorry, I'm talking in dollars. Sales were highly concentrated with just 7% of product generating 38% of the total revenue, a case of the Pareto principle in action. The Pareto principle is also known as the 80-20 rule and state that for many outcomes, roughly 80% of the consequence come from 20% of the causes. Then, as a key finding of the papers, nearly half, 47% of the products surpassed average development costs within 5 years, increasing to 75% within a decade. However, when accounting for additional costs, these figures drop to 21% at 5 years and 46% at 10 years. So the result of this paper paint a nuanced picture of the pharmaceutical industry. While sales revenue are unevenly distributed, favoring a small percentage of blockbuster drugs, the majority of products do eventually generate revenue that exceed their development cost within a 10-year time frame. This study provided valuable insight into the economics of drug development market dynamics, crucial for understanding healthcare costs and pharmaceutical innovation.
Yeah, and you kind of mentioned it, but can you tell our audience what are the factors that contribute to this highly skewed distribution of sales revenues
I'll
agents? I think
touch on
that's
five
an important.
aspects. So there is the market exclusivity. It's the market's let's think of it as the market company golden ticket. Drug with a longer period of market exclusivity can rake in higher revenues simply because they don't face generic competition. They're having quite literally a monopoly for selling their drugs. Then there are the blockbuster drugs that we mentioned. Those are the rock star of the pharmaceutical world. Drug like atorvastatin, better known as Lipitor, can generate billions in sales, effectively subsidizing many lower selling drugs. They're the heavy lifter that significantly boost average sales figures. Then there are different pricing strategies. In the high stakes world of drug pricing, companies employed various tactics to maximize revenue. This could involve premium pricing for innovative treatment or strategic pricing based on drug perceived value. Then they can have an expedited regulatory review. When a drug receives a fast track approval from a regulatory agency like the FDA, it can hit the market sooner. And this head start can translate into extended period of sale before facing competition. So they keep their monopoly for longer because the market exclusivity is usually set for a few years, starting on when the drug is discovered. And then there are the different therapeutic areas. Not all drugs are created equal in terms of revenue potential. Antineoplastic and immunomodulating agents often command premium price. They're typically high demands and greater willingness to pay for innovative treatment in these life-saving categories. So these factors combine to create a pharmaceutical landscape where a small number of drugs generate a disproportionate amount of revenue.
Yes, I always like reading these papers because they are subtle, but they are telling you there are some negotiations, some back and forth, some lobbying. Because why will it be that some drugs are going to get expedite review by an agency that is supposed to be neutral, that is supposed to be more oriented to our results and patients and health and safety? Then the opposite, there are pharmaceutical companies that are more towards a economic model that it's to develop profit based on findings of research development and all of that. Again, they're not saying anything that it's wrong, but I just like to read when they try to talk about these things without saying yes, there might be something wrong here, but again, this is the world we live in. So you mentioned market exclusivity, you mentioned also the blockbuster drugs,
Where the
then the
blockbuster
expedite
drugs and the
review,
therapeutic
pricing
areas,
strategies, and the last one was which one?
because each of them, even the drugs for children, then
Ah,
might be
therapeutic
a
areas. Yeah, yeah, yeah.
longer
Okay.
monopoly, longer like time for them to. So yeah, different drugs can have
Yeah.
play under different rules, no? And as I mentioned, they also have different willingness to pay, which is quite interesting because those are drugs kind of set by the society and the weight we give to those diseases.
Yeah, different
So
mix.
pretty fascinating to look into this.
Yeah, yeah, yeah. Yeah, exactly. Interesting. So for all of you that didn't pay too much attention, Matilde actually discussed three papers: Mexico, Serbia, and the FDA paper. While I only discussed two. So to compensate for that, I'm going to close this episode and I'm going to recommend a book. I usually try to recommend books that I have finished, that I have the conclusions, that I can point, okay, you are not going to regret reading this. But for now, I'm going to take a leap of faith and I'm going to recommend you a book that I'm currently reading that was actually recommended in one of those Nature Briefings newsletter. And it's called Limitarianism. The author is Ingrid Robbins. So let's say that you are a person that is concerned about the growing gap between the rich and the poor. Let's say that you believe that the extreme wealth poses a threat to democracy and the environment. So if you are this kind of person, then I highly recommend reading Limitarianism. So in this book, Robbins is going to introduce the concept of limitarianism. That is an idea that calls for a cap on individual wealth accumulation. So she is going to draw from a decade of research. She's going to present a well-reasoned argument that extreme wealth is not only unjustifiable, but also harmful to society as a whole. So far, I'm in the second chapter, if I don't recall that wrong. It's 300 pages long, so it's quite standard. I have not found a lot of political leaning ideas. I have not found anything that is opposite to what the research is saying. I read also on this Nature newsletter that the conclusion is going to be somewhere around 10 million euros or US dollars. I don't recall correctly. It's going to be dollars because it's more universal. 10 million euros of, let's say, how much a person can possess between their bank accounts, between properties, between cars, investment, all of that. So the wealth of a person cannot exceed 10 million at any point during their lives. According to the data, this is very much based on interviews and polls that they have developed in Europe. So it will be good to see how this replicates or how this finds in the USA. I have not seen again any evidence of this in the book yet. I don't know if it is going to be presented. So again, this is just a long essay to say not that rich people are morally wrong, but there is something wrong that markets are not doing well enough to limit the amount of people that can generate so much wealth. And I think the opening argument is quite compelling. When 1% of all the people in the USA owns as much as the bottom 90%, there's something weird. So I think that was like the hang for me, and that why I keep reading this book. So it's a good book for the summer. You are going to read a different ideas. If you like how markets work, then you might challenge your own ideas. So I invite everyone who is willing to, let's say, challenge what they have been thinking for so long, that if you work hard, you should earn more than other people. Then give it a try to this book.
A very light reading
Limitarianism.
for the summer. No? Also, kudos on bringing everything back to nature, from the newsletter recommendation to the paper and finally the book. So quite impressive or you did the connection between everything. And yeah, finally, what a book. Very curious about it. I'll definitely put it in my list of book, very long list of book I need to read. So I'll give you my feedback when I finally reach it.
Again, I have not completed the book. I don't know what is going to be the overall conclusion. I don't know if I will agree. I just know that a priori, I kind of agree with limiting how much people can own during their lives. I also agree $10 million is a lot of money. So I don't know, let's say, because you also need to think about actors, you need to think about sports people, you need to think about, I don't know, entertainment as a whole, when there are millions and millions of dollars for just one person. And again, I'm not trying to say that every millionaire is bad. So that might be one of the caveats that I'm trying to see, that I'm starting to see
Yeah.
in the
A
in the
very
in the
biased opinion in the fact that neither of us are millionaire or billionaire, as far as I know. So I can imagine we have different opinion on base of those policies. So I quite look forward to read it. So yeah, I think this is the end of this special summer edition. What a pleasure to be here with all of you, and especially with you, Ogun, discussing yet again some health economics and global health, and discovering newsletters, book, different papers. Always important to keep up to date, to learn, and yeah. So thank you all for listening to this special summer episode. This time we'll see you next month. As usual, we're going back to the normal programmation. Goodbye, Ogun. Goodbye, everyone.
Bye-bye, Matilde, and thank you everyone for listening more than 40 minutes right now of recording. Next episode will be a little bit shorter, and as usual, please recommend if you like our work to your colleagues and anyone who might find interesting talking about health economics, books, and newsletter. Enjoy your summer, and we will hear each other next month. Thank you. Bye-bye.